Welcome to another episode of Med Madness. In today's episode, we will be discussing an important topic, the interpretation of Pap smear results that may require endometrial evaluation. We'll break down the scenarios in which different findings on a Pap test necessitate further investigation and the rationale behind these recommendations. By the end of this episode, you'll have a clearer understanding of how to approach Pap smear results in both premenopausal and postmenopausal women. Pap smears are a vital tool in detecting cervical abnormalities and preventing cervical cancer. However, they can also provide insight into endometrial health. Let's delve into the key groups requiring endometrial sampling based on Pap smear results. Next, let's discuss the groups requiring endometrial sampling. First, benign appearing endometrial cells. In premenopausal women, endometrial sampling is indicated if they have abnormal uterine bleeding or are at risk for endometrial hyperplasia. In postmenopausal women, all cases require endometrial sampling due to the higher risk of endometrial pathology. Next, atypical glandular cells in women aged 35 or older or at risk for endometrial hyperplasia. All cases need endometrial sampling to rule out malignancy. Finally, atypical glandular cells favor neoplastic. All women with these findings always require endometrial sampling due to the significant risk of underlying cancer. Now let's move on to age-based reporting and management of endometrial cells on Pap testing. For women under the age of 45, endometrial cells are not typically reported because they are a common benign finding, especially within the first 10 days of the menstrual cycle. For women aged 45 and older, endometrial cells are reported as they can indicate a higher risk of endometrial hyperplasia or cancer, particularly in postmenopausal women, those with symptoms like abnormal uterine bleeding, or those at high risk due to factors like unopposed estrogen from obesity or chronic anovulation. Next, let's consider a real-life case study. Consider a 45-year-old premenopausal woman who undergoes a routine Pap test. The test reports benign appearing endometrial cells. She is asymptomatic with no abnormal uterine bleeding and has no risk factors such as obesity. Additionally, she is taking a combined estrogen-progestin oral contraceptive pill which lowers her risk of endometrial hyperplasia and cancer. In this scenario, despite her age, she requires no additional evaluation such as an endometrial biopsy and can continue with routine Pap testing. In contrast, if atypical glandular cells were found, the management would be different. These cells carry a significant risk for malignancy, necessitating endometrial sampling to ensure no underlying cancer is present. Next, let's talk about other considerations. Cervical conization and colposcopy are used to evaluate for cervical cancer in patients with cervical intraepithelial lesions on Pap testing or gross abnormalities of the cervix. Pelvic ultrasonography can be used to assess the risk of endometrial cancer in postmenopausal women with bleeding, but is not indicated for asymptomatic or premenopausal patients. In summary, understanding the implications of different findings on a Pap smear is crucial for appropriate endometrial evaluation. For premenopausal women, benign appearing endometrial cells usually do not require further action unless they have symptoms or risk factors. For women aged 45 and older, the presence of endometrial cells is more concerning and often requires additional investigation. Thank you for tuning into this episode of Med Madness. Be sure to engage with the pre- and post-podcast quizzes and Anki flashcards available on our platform to reinforce your learning. These tools are designed to help you master the material and prepare effectively for your exams. Until next time, stay curious and keep learning.